This is Hello Healthy, a Dignity Health podcast. Here's Bill Klaproth.
With robot-assisted surgery, you can look forward to feeling better and getting back on your feet sooner. So let's learn more at Dr. Lawrence Malalari, a colon and rectal surgeon and medical director of the SA Camp Company's Robotic Surgical Center at Mercy Hospitals of Bakersfield. Dr. Malalari, thank you for your time. So can you give us an overview of the SA Camp Company's robotic surgery program at Mercy Hospitals of Bakersfield?
Sure. So the SA Camp Company's Robotic Surgery Center is a new robotics program here at Mercy Hospital in Bakersfield. A program that was started with excellence, quality, and patient safety in mind from the beginning. We were not the first robotic program in Bakersfield, but we wanted to be the best.
And that is always a worthy mission. So can you explain this to us? I think a lot of people might think that a robot is doing surgery on me, which isn't the case. So can you explain robotic surgery to us?
Absolutely, and that's actually a comment I hear quite often. So you're absolutely correct. So while robotic surgery, as the name states, involves a robotic platform, the surgery itself is actually completely performed by the surgeon. Every aspect of the surgery, from the beginning to the end, is fully controlled and fully manipulated by the surgeon. What the robotic surgery allows, or the robotic platform allows the surgeon to do, however, is reach areas that would be otherwise difficult to reach with hands or with instruments. The robotic platform allows very small incisions to be made in the patient's abdomen and insert instruments, camera, and other surgical pieces of equipment that allow the surgeon to perform very complex surgeries through those small incisions. Now, those small incisions have several benefits. Cosmesis is the least of all, but the smaller the incision is, the less pain the patient is going to feel. The smaller the incision is, the smaller the area that needs to heal as a wound. The less pain patient feels, the sooner they'll be able to get out of bed and ambulate or move around their hospital room or even at home. The sooner they'll feel ready to leave the hospital. The smaller the incisions, the more minimally invasive the procedure is performed. We know that those procedures also have lower complication rates. Patients who have to stay in bed for long periods of time are at high risk of getting things like pneumonia or wound infections, urinary tract infections. Robotic surgeries allows us to decrease those risks significantly.
Yeah, that makes sense. So let me go over the benefits again, as you really articulated this well. So smaller incisions means less recovery time, less pain, and lower complication rates. And then for the surgeon, you mentioned a camera. This provides better vision, right? And it really gives you the ability to be really targeted in your surgical operation. Is that one of the benefits to the surgeon of robotic surgery?
It is, and actually it's a benefit to the surgeon and the patient. Robotic surgery camera actually has two cameras in it. Through that small opening in the belly, a double camera is inserted, so you get stereoscopic vision inside the patient. Laparoscopic surgery does not have that. What stereoscopic vision means is that you're not just getting crystal clear pictures and images of what's going on inside, but you're actually getting depth perception. Basically, the same way the surgeon sees with his or her own eyes is what the image of a robotic camera provides, which is extremely helpful in very meticulous dissections or complex procedures.
Well, the benefits for you and the patient are easy to see. So what procedures at Dignity Health Mercy Hospital use robotic surgery?
So currently we have quite a few specialties offering robotic surgery to their patients. This includes general surgeries for things like hernia procedures or gallbladder removals, colorectal surgery, which involves benign disease like diverticulitis, for example, or even cancer surgery like colon cancer or rectal cancer. We also have OBGYN physicians who provide robotic surgery to their patients, a GYN oncologist who provides or offers, I should say, his services on patients who have GYN cancers like uterine cancer, ovarian cancer, or cervical cancer. Also, a urogynecologist who provides care to patients who have pelvic floor dysfunction and urinary symptoms, and also urologists. And think about things like kidney cancer, prostate cancer, even benign, lesions that usually would require quite extensive surgeries and incisions are being offered through a robotic platform.
So a very wide range of robot-assisted surgery is available. So you have achieved a Center of Excellence designation in robotics. Can you explain to us what that is?
Yeah, so when we set up this program, as I mentioned earlier, excellence, quality, and patient safety were kind of the at the top of our list as far as the pillars where we were going to build this program at the center on. But while we endeavored to make sure that was the case, both with our own monitoring of the program, we wanted an independent evaluation of the program to confirm for us that the work that we're doing was indeed showing those efforts. So we engaged Surgical Review Corporation, also known as SRC, which is a nonprofit, independent patient safety organization that does accreditation of facilities in multi-specialties. This is a company that's international, is accredited facilities in more than 35 countries in the world, and has a very rigorous review process. And that is what we engaged to evaluate our program, so to speak, and show us that the work that we were doing was actually bearing fruits. And we had that evaluation performed, and after that rigorous review of all the robotic procedures that we had done over a past year, including the quality of the procedure, the safety of the procedure, but also patient outcomes from that procedure. And this review, by the way, also involved a on-site evaluation of the facility and the staff by this organization. We were designated as a center of excellence in robotic surgery.
So what does this designation mean for the public then?
For the designation, obviously makes us feel good about the efforts that we put into this program. But at the end of the day, is the benefits to our community and to our patients that matters. And what this means is that our patients and our community can see the value of the program that we have. And when we state that we value and we care about the excellence and the quality of the care that we provide to our patients, is not just a lip service that most people hear from organizations all the time. This is backed up by an independent review of our program. That basically, we hope that will provide patients with the confidence that the program is giving them excellent world-class care.
And then, Dr. Malalari, last question. What else do Bakersfield residents need to know about Mercy Hospital and their robotic surgery program?
I think the Bakersfield residents and the community at large needs to basically be aware that this program is here. This program is well established now, and especially with the independent review that we had, we're able to offer our patients in our community excellent care in robotic surgery right here in Bakersfield, and we'll continue to strive to not only maintain this excellence, but improve it as time moves forward.
Really important, and so happy to have this valuable surgery program right here in our backyard. Dr. Malalari, thank you so much for explaining robotic-assisted surgery to us today.
Thank you, Bill. Thanks for having me.
That's Dr. Lawrence Malalari, and to learn more, please visit dignityhealth.org/Bakersfield/robotic surgery. And if you found this podcast helpful, please share it on your social channels, and be sure to check out the full podcast library for topics of interest to you. This is Hello Healthy, a Dignity Health podcast. I'm Bill Klaproth. Thanks for listening.